All right. Awesome. Awesome. Thank you again for hopping on the call with me.
Yeah, you're welcome. Absolutely.
Super, super excited for this series, like I mentioned, or PT Possibility series. Sorry about that. And it's just basically bringing awareness to the various possibilities that PT students, pre-PT students have for their lives and their careers, like out of the traditional scope of what we think that physical therapists can only do. So thank you for hopping on.
I love it. I love it. Nice. Well, I'm happy to chat about anything.
Yeah, awesome. So tell everyone about yourself because I've met you. I've seen you at SSHC conference. We've spoken many a times. But tell the folks who you are.
Yeah, so my name is Josh Payne. I've been a physical therapist for 7 years. And basically, we'll start with today. Today, as of now, I am a full-time coach for physical therapists, helping them do start and run concierge practices. But it didn't always start that way. So we'll go back to the very, very beginning. Um, I graduated from Texas Tech PT school in May 2013. And I'm sure we can always get into some of the journey. I'm not going to get into too much of that, but basically just quickly found that the traditional way was not the best way for me, and that really got the wheels spinning as to other ways that I could make a living as a PT. And it's
Awesome.
led me on this incredible journey. That's the shortened version for you.
Yeah, because I've actually read your book. That's I think a whole different day and a different topic because your book was definitely eye opening to me because I that's when I got your book was at Smart Success last year, and
Awesome.
it was just like, wait, what? Like this is just a different way of thinking and actually cued me into having more of a guideline for the population that I wanted to serve. So hearing your story was definitely inspiring, and wanted to get that uncaged mentality, of course, with the patient population and myself as like what I wanted out of my life. So um, I know your specialties is concierge. What exactly is concierge PT? I know many people might not have even heard of it. If they have heard of it, they might have a misconception. So, what exactly does that entail?
Yes, so some people call it mobile PT, some people call it concierge PT. Really the same thing. Concierge is just a fancier word that I like to use, and I'll explain that in a second. But really all it is a fee-for-service model. So you're not taking insurance. A fee-for-service model, or as we like to say it in physical therapy, cash model. Basically where people give you cash, and that's not physical cash. Now some people decide to do that, but we're talking about that they just give you money out of their pocket and not using their insurance. So that's what the model is. But basically, you are going to them, seeing them in their home, their office, wherever is comfortable for them. The best way that I like to explain it is it's almost like an outpatient clinic visit inside of a home, and then minus the insurance.
Okay.
So that's probably the best way that I can explain it is just you're doing up higher level of care one on one in the home. The only difference that gets people confused is just we're not having any affiliation with insurance.
Okay. Interesting. So what got you into physical therapy? Like, how did you find physical therapy, and what was that draw-in moment for you?
Yeah, so I was actually I was studying to be an athletic trainer for a long time. I've been in sports all my life, and I was actually in between, my senior year of undergrad at Texas Tech. I was working with SMU football during the summers and really trying to learn as much as I can to become an athletic trainer for, my goal was like a college football team.
Mm.
And there's nothing against that profession. I love it, but there was something that the head trainer that I knew really well. That's actually how I got the in to do that. I knew him very well, and he basically told me, he said, "Josh, like, I just want you to know, if this is something that you want to go into, when it's the season, like, I don't see my family. Like
Mm.
I'm at the university all day long. Like you really got to love this. You really got to be all in, and you've got to be willing to make the sacrifices for these athletes. And I really thought about it. I was like, that's cool. I love how much passion he has around it. But at the same time, at the time, I didn't have a son, but I had a goal to grow a family.
Yeah.
Um, and I was just like, I'm not sure if that's what I want. And then a lot of times as I'm like sweating in 105, 110-degree
I
heat,
bet.
and I'm just filling up water bottles for athletes, I couldn't help but feel like, what am I doing? Like, is this like really what I want to be studying my butt off for? I hate to say it because like there's those athletic trainers are absolutely amazing, but I really didn't get to start doing some of that hands-on work because I was just a student at the time. But I felt like a glorified water boy,
Mm.
and that bothered me. I was just like, I'm busting my butt to learn all of this stuff. Like I want to be able to put it to action. And so it just didn't overall, the whole career choice like didn't jive with me. And I was like, you know what, I need to find something different. And then crazy thing that happened, I go skiing on during March during spring break up in Breckenridge, Colorado, and I had the I tore my ACL completely, MCL, meniscus, everything while skiing. The unhappy triad, as we learn in school, and it was going through rehab and the physical therapist that helped me through all of that. That's when I changed my path, and I was like, "Ooh, physical therapy is it. This is so much. This is exactly what I'm looking for. To doing is working close with people and helping them." And that's when I switched everything and went into physical therapy.
Wow. So it wasn't until your own injury that like light bulb moment came, because you were already, like you said, super active, super involved in sports, movement, and things of that nature. And so what about that patient interaction really pulled you into the profession?
Yeah, it was, funny thing is, it was your typical super busy clinic. I only saw the therapist maybe 15 minutes each visit, and then they would pass me on to a tech. But this specific physical therapist, he was a guy probably in his early 40s and just had that super caring personality about him. Like I could just tell that every time I came in that how much he cared about seeing my progress. And his, to be honest, like his manual skills and everything that he did with me, it did make me feel better. And it made me feel like I've got like a person on my team to achieve what I wanted to do. And I was a terrible patient too. I was bad at doing my exercises. I was only 21 at the time and I'm 32 now. So it's been 11 years. I was a terrible patient. And I just, it was really comforting having someone like that on my side where I like truly felt like he knew what he was doing, was really knowledgeable, and was really caring too. And so I kind of aspired to be more like him when I grew up, if you will.
Wow. Wow. And so how do you treat your patients with the concierge practice? Like who do you see? What is your typical patient demographic?
Yeah, so most people know me for seeing, in Denver, we basically created a practice around, we saw high-level executives and CEOs of companies. But really, most people, when they think of that, they think about these like young, like go-getter women and guys, and that really wasn't it. Like more our niche was actually older individuals, 60, 70 years old, that had been running a business for a long time, or running a family business or something like that. And they were tired and they had, problems, and they realized that, whoa, once I hit that 60 mark, I'm no longer invincible. Those were our clients, and that's why it works so well with the concierge model.
Yeah, yeah, that harsh reality of like no longer a young whippersnapper, if you they
Yes,
say.
yeah. And these are like high charging, like adults that have just like, crushed it in business and in a lot of areas in their lives. And then all of a sudden they come crashing down in their 60s with, injuries or pain or ailments, diseases, all, chronic problems, all kinds of stuff like that. And then they're trying to find a solution to someone who can actually be with them on a, and help them more on a regular basis. So that's what we did.
Wow. Yeah. So what drew you to this population as opposed to others? Because like mobile practice or concierge, I mean, it can be anyone really. So what experience did you have that really drew you into that group, or what pulled you in?
Yeah, no, I'm really glad you asked, because I think this will be really good for your audience to hear. Is most people nowadays, when they read my book up
Yes.
there
Amazing.
and different things like that, they're like, Josh, I want to see executives and CEOs like you did. I get it. They've got lots of money. They can afford this. That's amazing. And I always tell people this exact story because I want to make sure that they understand. I didn't actually go into that because they have lots of money. It was my last home health job I ever had. My wife and I had just moved to Denver, and it was the third patient they gave me in home health, and I pulled up to a beautiful home in this area called Cherry Hills in Denver, and basically I'm reviewing this guy's medical history, and older gentleman, probably in his late 60s, and actually no, late 70s at the time. And I'm looking at it, and I hadn't reviewed it at all until I got to the house. And I'm reading this outside of his house, and I'll never forget reading post third MI, post third myocardial infarction, his third heart attack. I'd never seen anybody with two heart attacks, nevertheless three, and survived. And so I was like, oh my gosh, like I don't know what I'm going to walk into. And I come in, and it's kind of what you would expect: on oxygen, nasal cannula, all that stuff. This guy could barely walk 10 feet without just plummeting past like 85%. And so he'd have to sit down, chest going crazy, like breathing for air. It was crazy to see. And for even being in home health for a while, I still had never seen a client like this. And on the second visit, me and this older gentleman just had like this cool little bond, and it was like a father-son bond. And quickly on that second visit, he just says, "Son." He would always call me son for whatever reason, even after just knowing me after 2 visits. But son, I want you to understand something. You're a young guy. You're an energetic guy. You're full of energy. I can see that you're driven. I can see that you really enjoy what you do. The best piece of advice that I'll ever give you is do not ever let your work come before your health. And he went on to tell me, he said, this is the crazy part that everybody's like, oh my gosh. This guy was on the team that basically built the floppy disk.
What? Oh yeah, my
God. So most people don't know what the floppy disk is, but it was a big deal back in the day. And this guy made a lot of money from it, a lot of money. And so basically from getting to know him, what he told me with his story was, a typical room when these guys were working was smoking, drinking, terrible eating habits, definitely not exercising, just not seeing their families, just grinding away. And yeah, they accomplished something phenomenal for the time. Now we look at the floppy disk and it's just a joke now. But at the time, it was an amazing feat, right? It was really innovative. And so he made a lot of money from it. And he basically told me along the way, after really about 6 weeks of seeing him, that he had achieved all the money and all of the success that he could have ever wanted in his career. But now he doesn't even have anywhere close to the health to enjoy that. And that really impacted me. And so from that visit forward, I already had the balls rolling in my head about a concierge practice. And I was like, small business owners, like they're all on this hustle and grind these days. They don't take care of themselves. And that's where it all started. So it actually didn't start because of, ooh, they've got a lot of money. It started because of, hey, this is a population of people that actually really needs help. And I always remember that guy and said, I used to ask myself, like, I wonder if I could get to somebody before that happens, because that's a big deal. And I saw how crushed this guy was. To be very frank with everybody, This guy was going to go to the grave wishing that he could have gone back 30 years and done things a lot differently. That regret is crazy. And that's what made a big impact on me. And I was like, okay, I need to move forward with a business like this. So
yeah. Wow. So the young Mark Zuckerbergs of the world, if you will, and just making sure that they can literally live in order to enjoy the empire that they've built for themselves, and that grind and that grit, like you were saying. I remember you were saying in your book, even with you and your own grind, you were like, man, I'm burning out. I'm just starting practice, and this is getting exhausting. And I think our bodies definitely pay a huge toll when we're in that grind, we're in that hustle. And it's always important to check in with yourself. But if you're unaware of these things, you can go years like that, you know?
Absolutely. Yeah.
Wow. So what does a typical day look like in concierge physical therapy?
Yeah.
And
So
what is your approach to how you treat these people that might be different than a traditional outpatient ortho clinic?
Yeah. So to give your audience context, because most of them are, I'm assuming, pre-PTs, a typical home health day, or actually, no, let's start with outpatient. And this is not to scare any of you guys. Physical therapy is the best profession in the world. Don't forget that. I'm not being negative. I'm just being realistic. So a typical outpatient day, you're probably going to see close to 20 patients. Yeah. Typical outpatient. Now, there are really phenomenal outpatient clinics where maybe you'll see eight, 9 clients a day, something like that. It all depends on how they run the show, right? And then now let's go to home health, because you're driving around to people's homes. Probably max amount of people that you're going to see in a day. A typical home health day, you're probably going to see between 7 and 8 clients. But it's still a grind. It really is. And so for me, when I set out with the practice, I said, I never want to see more than 5 clients a day, ever. And that was my hard line in the sand. But most days for me looks like 4 to 5 client visits, Monday through Friday. And then eventually I started to take off Wednesdays as well. So basically Monday and Tuesday and Thursday and Friday, I would see about 5 clients per day. So about 20 a week. And had an incredible practice from there. But why I set it up like that was we do 1 hour visits for everyone. Sometimes, an hour and 15 minutes or so if needed, if somebody needs to be just, if they just need to talk to someone or whatever it may be, or whatever it is. Like, so how I set it up is this. Let's say I have a visit at 8 a.m. My second visit will be set up at 10 a.m. And then if I have another visit, it's at 12, next visit, it's at 2, and so on. And here's why, because I started to realize with like this concierge level of care, I want to be there for my clients. And here was my rule. I never, ever, ever want any of my clients to feel like that I'm rushing out the door to go see another one. And so my rule was, I want the client that I'm seeing right now to feel like that they're my only client on the schedule for the day. And, if they want to, like, I used to see some amazing people in the Asha, like, incredible human beings. And, I had men and women that maybe like they wanted to, some of these people had like, like a golf range in their backyard. Like, and I'm terrible at golf. I had one guy that always would love to teach me little tips after our sessions. I want to be able to do that with them. I had one woman, older woman, in her 90s, she just loved talking with me. And we would finish our sessions and I just kind of sit back and we just chat for 10 to 15 minutes. That same woman, sometimes I would see her every single Friday for actually for the last 2 years. Sometimes on Fridays, I'll just go grab 2 donuts because she loves donuts, and we'll sit after our session at our dining room table and we'll just eat one donut together and just chat. I know that's contradictive. I know we're supposed to be healthy.
Everyone eats donuts. Cut it out, y'all.
Whatever. But I wanted to be able to do stuff like that to create that deeper relationship with people. Yeah. And I think one thing to take from this for the pre-PTs is you'll hear a lot about, you've got to have that provider-patient relationship. And I think it's true to an extent, but I've actually found the more that I can get closer with my clients and really treat them like family, the better relationships that you have. So, and the better results that you'll get out of them as well. So,
Yeah. Yeah. Creating that deeper connection, I think, is huge. Because even with your first PT interaction, like the level of that connection was what drew you in. And I think a lot of the times because, the idea of like being a doctor, you have to be very cold and distant. And it's actually the opposite. I know when I go into a doctor visit, if they're like very distant and cold, I'm like, I don't really want to work with you, right? Like you, at the end of the day, it's still like a business. And if you feel as though you don't have that connection and you feel as though that person doesn't really truly care about you, are you going to want to hand them your money? No, right? And especially as something as intimate as your own body is huge. It's huge. So I definitely understand wanting to create that relationship. And I think a lot of pre-PTs go in with that false idea of it should be icy, it should be cold because, I'm the doctor, you're the patient. But in reality, yeah. In reality, it's actually quite opposite. You'll find that you'll get a lot of more trust, like Josh mentioned, and a lot more adhesion to your programs if your patients or your clients actually have a relationship with you, and treating them like a person as opposed to a ligament, right? Just a upper extremity, lower extremity, black and white ideology of it. So for sure.
You got it.
Yeah. And so what advice, how would you guide somebody that actually wants to be in that profession? Because I know you mentioned not just getting into it because of the money, but if you were in these individuals' shoes, how would you get started knowing what you know today?
Knowing what I know today is I know how important it is when you have it's a service-based business is really what it is. When you have a service-based business, you have to serve a particular type of person. It can't be, honestly, a lot of outpatient clinics that take insurance, they cast wide nets. They're able to bring all types of people in because really all they're doing is just being sent their way from a doctor's prescription in a lot of cases. So that's okay. But when you have a cash-based business or a fee-for-service business, you need to serve a particular population. So my advice to pre-PTs, if this sounds like something, yeah, I'd love to do that when I get out of school, take the time in school to really start thinking about, like, who do I enjoy working with? Who in my experience so far have I really, really enjoyed working with? If I had to choose one type of client to work with for the rest of my life, who would it be? That's actually one question that we give our active coaching clients who pay us to work with us is one of the first questions I'll ask them about niche is, let's put ourselves in a weird like physical therapy world. And once you decide to be a physical therapist, you have to choose one type of person, one type of avatar to work with for the rest of your life, and you can never change. You can't go back on that decision. You got to make it right now. And I force them to make a decision. And lots of times that significantly helps people say, well, if I had to force myself to do it, I'd pick this type of person. I'd pick an athlete post ACL. Great. Now we have a specific type of person to go after. But that's the biggest problem, even with PTs that I see that are 5, 10, 15 years out, is they have no specification. They have no specific type of person that they like to work with. They become a generalist, not someone who can specifically help a specific type of person. And I'll tell you that anytime you can help a specific type of person, people will pay you money. Yeah. Hands down. There's nothing against, nothing with selling. Yes, you got to learn how to sell and all of that stuff. But if you have a solution to a specific type of person's problem, people will pay you.
Yeah. Yeah. And I think a lot of the time what we traditionally see, the only PT niche is like NFL or NBA, like something very, and then it gets that idea of like, oh my gosh, it's so competitive. How am I going to be successful? And it's like, there's so many different avenues for you to be successful in. And so that's one of the missions that I'm trying to bring with this series, because I know there's so many different avenues, like you said. And if you can articulate and serve one group, one population, you're good. You're good to go.
Yeah. And one thing to add on that, like maybe you do have a dream to be a physical therapist in the NFL. If that is a dream in school, go all in on it. Like figure out for clinicals who's the best in the country that I can go follow. And it's going to be a tough process, believe me. Like getting the people that you want for clinicals is difficult, but go all in, find the best and be, because you're never going to be able to go through school again. And to be quite honest with all of you, I wish that I took school a little bit more seriously, to be quite honest with you. I was the guy that was just like, yeah, whatever. I just got to get through school type of
In
thing.
PT school?
Yep.
You were that guy in PT
I
school?
was that guy, Nyasha. I'm sorry to say, it's embarrassing to say, but I was that guy. I just wanted to get through. Like I was just so sick and tired of school. Like just get me through this stuff. I just like working with people. Like I love the human interaction, and I don't like taking tests and stuff. I've never been good at that. To give you guys even more confidence in yourselves, because I've had, now it's fun. I can easily go back and talk about it and look back on it with a smile on my face. But I was like the guy that would get C's and maybe a B on tests. Like I just struggled in school, and I've been able to have a lot of success in my career and impact a lot of people. And so I'm not telling you to be like me. What I'm trying to say by saying all of this is take school more seriously than I did. That's now being 7 years removed from school. That's what I wish I would have known 10 years ago going into school is, hey, you only get these 3 years or these 2.5 years once. Give it everything you got.
Yeah. So you mentioned maximizing your clinical. What would be another thread of advice for somebody that's just about to start PT school in the next couple of months?
In the next couple of months, I think, well, you're a year or so or 2 years away from clinicals. So I think my advice immediately for you, if you're a pre-PT about to go into school, is just prepare yourself. And maybe your channel has heard this before, but it's going to be different than undergrad. You're going to be demanded, much more is going to be demanded of you, and you're going to be tested a lot more. I think if you can go into it just knowing that it's going to be hard, it actually helps it helps that become a little bit easier. And then the other thing is, your professors and the people that are helping you, make sure you absorb as much information as you possibly can from them. And then also, if you're like Nyasha and you've got a great network and people, like learn from those people as much as possible as well. Like, for example, I'm going to be talking to a PT school next Friday, and I'm just coming in and talking to them during their lunch. And apparently, a lot of the students do that, is they find people that they aspire to be like in the PT field, and they just tell their professor, hey, can we have them come talk to us at lunch? Like, what? I never did that. I never did that, Nyasha. Like, I was the guy that barely even came to class. Don't be like me. Like, that's what I'm trying to say. Like, I like, that's my biggest regret of PT school, because what happened, guys, I'm just being super real with you. What happened is I was just so much further behind probably everyone else when I came out of school. Like, it was just, when I got my first job, I felt like I had zero idea what I was doing. And then all of a sudden I had these thoughts come rushing to me like, crap, should have paid more attention. Yeah, and I had to learn everything through experience. And so you might have that feeling anyway when you go into clinicals. So don't be ashamed if you do. We all do. But I think the advice that I would give you, again, 10 times over, is just, work hard at it and really pay attention and absorb information and just be constantly curious from professors, from outside people, and utilize them.
Yeah.
I feel
Wow.
like that's some broad advice, but it's coming from here, so that I really mean it.
I felt it. I felt it from you, Josh. I did. I did. Because I think a lot of the time when people are done with school and they have this title and these accomplishments, they kind of negate the journey that it took to get there. And like you said, it was a grind, it was a hustle, and your level of experience, like I think having that level of reflection is really important for people to know too, because I think a lot of the time, like, I don't really need this. I'm not gonna go into this field or this niche, so I don't really need to know this. Like, I just need it for boards or whatever the case may be. And I'm not gonna lie, I had those moments because I already know what niche I want to work with, and so I've already kind of gone in with a little bit of I don't really need to. We could throw that under the rug, but I
Yep.
think it when you have that level of reflection and knowing where your fumbles were, I think like people like you mentioned, people able to learn from you, because I've already heard of some of my classmates that are starting. They're like, I don't really need to know this, and it's already coming into that idea. So keeping an open mind and just being a sponge for information. Would you agree, Josh? Like just being a sponge and absorbing everything while in school, and also remembering to have fun while absorbing that, right? Because I think along the
Completely.
way, we get so tied up with like wanting to get that A, wanting to get that score, or just simply passing, like Josh said, but create like a mental puzzle of how you can like apply these things to so many people. Because I'm imagining there's things that you learned in school that you probably had to brush up on because in some way, shape, or form, you bumped into a patient that you had to have that application. Is that correct?
Absolutely. Yeah.
Yeah.
Yeah. And that's why experience becomes so important, is because it's going to force you to go back and study things again and relook at things and open up old textbooks, ask more questions. So experience is going to get you there as well. But yeah, you want to set a solid foundation. And if you don't take it seriously like I did, then you're coming out of school with a not a full foundation, is the best way to put it. And a house that's built on an unstable foundation is not a good house, right?
Let's start cracking in
So
places.
yeah, it's going to start cracking in places, and we really shouldn't be building walls and windows and roof. We really shouldn't be doing that until we have a solid foundation. So just look at your schooling like that.
Yeah, yeah. Would you also say that when it comes to school, that foundation, start broad and you can always zone in after?
Absolutely. Yeah.
Right, right. Awesome.
Yeah.
Thank you. Thank you so much, Josh. It was absolute pleasure. I think just having a different perspective is always so important, and opening up the minds for concierge, like you said, this is something that you started and you started to generate, and it wasn't this one size fits all idea of success, right? You have, I would imagine, other clinicians under you. You're training clinicians, like you said, to do these things and have these possibilities and have this life for themselves and have that patient interaction that they so long for. So that is definitely huge. Thank you so much.
Yeah, you're welcome. And I'll say one more thing, just because I feel like it'd be a good kind of lesson for everybody is, 4 years ago, you would have told me that, I don't even treat anymore, guys. Like I just help physical therapists to be successful with their own businesses. And that gives me so much fulfillment, because they're able to go out there and make such a great impact on their clients. But I would have laughed if somebody told me I was doing that. I was going to be doing that where I am now. And just understand that something that I say all the time that I'll leave you guys with is continue to push into the unknown, because the unknown is where life gets fun. And I think that's really, really true. Is if you're anything like me, when you come out of school and you're just like, you want to push the boundaries and you want to see what else is out there in physical therapy, explore it, explore everything that there is out there, and don't be afraid to try a few different areas. If you come out of school and maybe you're not like Nyasha and you have no idea what the heck you're going to do, don't be afraid to explore. You're not job hopping. You're just trying to figure out like what you're really trying to do. But don't be afraid to push into the unknown, because if I would have never started a concierge practice, I would have never had a successful concierge practice. I would have never been able to now start a coaching business helping concierge practice owners. And to be quite honest with you, I would have never given my wife the opportunity to be a stay-at-home mom with our son if I hadn't followed this path. So I think it's really important just to be open and be open to exploring the unknown. Just because people are doing it one way doesn't mean you have to always follow that way. When I started a concierge practice in Denver, no one else in Denver had a concierge practice. I'm going to share one more story, and then we can wrap up, Nyasha, if you need to. But but I'll never forget being at a networking meeting in Denver, and it was called a healthcare provider networking group, and it was nurses, physical therapy practice owners, chiropractic practice owners, massage therapists, every type of healthcare professional that you could think. And it was this big networking group, and we would meet in this room, and I'd say about 12 to 15 people would show up to each meeting. I only went to 2 meetings, and I'll tell you why. But we were sitting around this large table, and on the second meeting, we basically went around the table and told everyone more about our business. And I told them about the concierge model and how basically I planned on seeing clients in their homes or offices for a membership style of business. So basically, they pay me an X amount to see me on retainer so that I can help them to achieve longer goals than just like 4 weeks. And I'm really jazzed about it. You guys can probably tell from after this call, like I get very excitable, and I'm excited about it. I'm telling people about it. And then there's silence afterwards. And the woman who was running the table at the end, I could picture Denise like the back of my head. Like she just starts cracking up. And she said, "Josh, do you realize that you're going to be asking people to pay more money per month than I pay for my mortgage?" And then the rest of the table just erupts. And there was, I'll never forget, there was a guy to my right that was just like, to be honest, that's ridiculous. And it was like the classic example. And I left that meeting so down, so ashamed, like, so just like, "Josh, what am I doing? Maybe this is a terrible idea." And that's because I was pushing against the grain, and I didn't realize that now. I was doing something different. And people's generally, doesn't make any of them bad people. It does not make Denise a bad person because she laughed. They're pushing against it because it's new. That's it. And so if you're going to be trying to be innovative in the field of physical therapy or in any field, you're going to get pushback no matter who you are and no matter what area that you're going into. And if I wouldn't have continued to push forward, if I would have let that meeting derail me, I never would have been able to start this entire thing. And so that's the last message I'll give is when you do anything new, you're going to have naysayers, and you're going to have people that don't believe in what you're doing. But that's the only way that new things are built. If we really are all in this profession to grow it and become the doctors that we want to be, and really be a profession where people really, really respect our profession, we are going to have to push it and innovate it and come up with new ways to treat clients, better ways to treat clients. And the only way, and you're going to hit pushback along the way.
Yeah. I think the road less traveled is always hard. We gotta, right? It's always hard, especially being that first one to put the foundation in. So I think our generation definitely has something to thank for sure, of those people, of the individuals like you that are pushing the envelope and it actually makes me super, super excited to see what the next generation of pre-PTs or physical therapists look like, because there's been so much momentum paving the way that instead of us now having to like really grit and push the field, we can come in with a different mindset and an innovation from the foundation that has been laid. So Thank you again, Josh. Thank you for that insight, and thank you for paving the way for so many physical therapists, pre-PTs that can actually have that mindset of non-traditional and feel okay with it, right? Because when you
Yeah.
first started off, like you mentioned, it is hard, it is difficult. But now that there's a pathway or a guidance system, like a GPS guidance system in a sense, because your book was that guidance system for a lot of people, can definitely change the field. So I'm really excited for where physical therapy is going in the next couple of years for sure.
Yeah, I am too. And I'm, thank you so much for having me on. And I just want to tell you that PTs like you, pre-PTs like you, that, I mean, you've got this YouTube channel to help deliver this message to other pre-PTs. Like, it's people like you that are going to change the game as well. So you're already doing it. You're already starting with it. And so props to you.
Thank you. Thank you so much, Josh. Thank you.